Hello everyone, welcome to Buddha Zen Wisdom. Aunt Chen was having lunch as usual when she suddenly clutched her chest, feeling uncomfortable. Her face grew increasingly pale, and beads of sweat rolled down her forehead. Seeing this, her family rushed over to ask what was wrong. Aunt Chen's gaze was vacant, and in an instant, she collapsed, unable to get up. Her family panicked, their minds went blank, unsure of what to do. It was her younger son who called for an ambulance. However, by the time she was transported to the hospital and resuscitated for several hours, they ultimately could not save her life. In their grief, her family was left puzzled. How could a perfectly normal meal lead to such a final farewell? Doctors remind us of 5 things to avoid after eating, yet many elderly people continue to do them. If you find this video helpful, please click subscribe and give a thumbs up to Buddhism. Don't forget to share it with your friends. Thank you for your support. 1. Eating too much increases the risk of sudden death. Those who frequently overeat need to be especially cautious. Dietary habits have a crucial impact on our health, as illustrated by Aunt Chen's case. She had maintained very poor eating habits, consistently overeating until she felt stuffed. Doctors pointed out that her sudden death was likely closely related to these habits. Many people have experienced feeling drowsy after a big meal. This has a scientific basis. When we overeat, our blood sugar levels rise rapidly. This change in blood sugar can decrease the secretion of a hormone from the hypothalamus that plays a critical role in regulating the body's state of wakefulness. This hormone is very sensitive to blood sugar changes. When the body is hungry, it secretes this hormone in large amounts, stimulating the nervous system and keeping the brain alert. However, once we eat too much, its secretion decreases, leading to drowsiness. So why does overeating increase the risk of sudden death? Several factors contribute to this. First, when we overeat, the stomach expands. The human body has limited space. An expanded stomach inevitably occupies space needed by other organs, forcing them to make room. For example, the diaphragm moves upward as the stomach expands, which can put pressure on the heart and affect its normal functioning. Additionally, during digestion, a large amount of blood is diverted to the gastrointestinal tract to meet digestive needs, increasing the cardiac workload. If the cardiovascular system is already weak, the heart may struggle to bear this additional burden, leading to myocardial infarction or even sudden death. Aunt Chen had coronary heart disease and was already at risk of vascular embolism and hardening. In this case, failing to control her diet and consistently overeating inadvertently increased the risk of sudden death. Patients with coronary heart disease already have damaged blood vessels, and their heart's ability to supply blood and self-regulate is relatively weak. When a large volume of blood flows to the gastrointestinal tract, the problem of insufficient cardiac blood supply becomes even more pronounced. Moreover, numerous experiments have shown that when the heart experiences organic changes, it exacerbates electrical instability, leading to chronic arrhythmias and potentially inducing cardiac arrest, increasing the risk of sudden death. Therefore, we must be cautious about our food intake in daily life and avoid overeating. Generally, eating to 70 to 80% fullness is appropriate. This can satisfy the body's nutritional needs without imposing an excessive burden. For those with cardiovascular diseases, it is even more critical to strictly control their diet and follow medical advice regarding dietary structure and intake. Additionally, we should develop good eating habits, avoiding binge eating and maintaining a balanced diet. Only by doing so can we better protect our health and reduce the risks of sudden death and other diseases. We must learn from Aunt Chen's case and recognize the severe consequences of poor dietary habits. While enjoying food, we should always pay attention to our physical condition, reasonably control our diet, and take responsibility for our health. 2. What is the correct posture after eating, sitting, standing, or walking? In daily life, what posture to adopt after a meal has always been a focal point of interest and controversy. Different people have different opinions and habits. Some firmly believe standing is best, thinking that 100 steps after a meal will help you live to 99. Others feel one should lie down after eating, enjoying the comfort of being full. Still, others believe resting while sitting is more beneficial for health. So, which posture is actually the correct choice after a meal? First, let's consider the practice of lying down after eating. Lying down immediately after a meal, when the stomach is full, can lead to the position of the stomach changing, making it easy for food and gastric acid to flow back into the esophagus, causing acid reflux or even heartburn. For certain special groups, such as the obese, elderly, or physically weak with slow sphincter contraction and insufficient gastric motility, this reflux situation may be more severe and could even lead to reflux esophagitis. This is because these individuals have relatively weaker bodily functions and less effective barriers between the stomach and esophagus. After lying down, changes in stomach pressure more readily lead to food reflux. Next, let's analyze the situation of sitting down after eating. Many people worry that sitting right after a meal will cause fat accumulation in the abdomen, leading to obesity. However, this claim is not entirely accurate. Sitting after eating mainly affects the efficiency of food digestion, potentially leading to indigestion. When sitting, the body is in a relatively static state, which slows down gastrointestinal motility, causing food to move more slowly through the digestive tract, hindering digestion and absorption. Moreover, those who habitually sit after meals often tend to be less active overall, and prolonged sitting slows down metabolism, making it easier for fat to accumulate. Therefore, this group is more likely to gain weight, not just because of sitting after eating. Finally, let's explore the benefits of standing after a meal. Standing is a relatively good choice. When we stand, our posture helps promote the downward movement of food. This is because standing allows the stomach and intestines to better utilize gravity to push food through the digestive tract, thereby reducing the time food remains in the stomach and improving digestive efficiency. Additionally, standing can help reduce fat accumulation since the muscles in the body are relatively tense and expend some energy, which helps maintain metabolism. If, while standing, we can also move our legs and arms appropriately, for example, by marching in place or doing gentle stretches, then the promotion of digestion will be even more significant. These actions can further stimulate gastrointestinal motility, facilitating a smoother digestive process. In summary, immediately lying down or sitting for long periods after a meal presents health risks, while standing appropriately and combining it with simple physical activities is more beneficial for digestion and overall health. Of course, everyone's physical condition and eating habits differ, so we can choose the posture after meals that best suits us to maintain good health and digestive function. 3. Beware of these 10 actions after eating, as they may be self-destructive. Diet is an indispensable part of life, and the habits we maintain after meals significantly impact our health. Everyone has different post-meal habits, but if any of the following actions are present, they may adversely affect lifespan and require our high vigilance. Eating fruit immediately. When one is in a full state after a meal, blood sugar levels continue to rise. This occurs because food gradually releases sugars during digestion, which are absorbed into the bloodstream. Eating fruit at this time not only does not aid digestion but also increases the digestive burden. Fruits contain sugars, which can further elevate blood sugar levels. When digestive organs are already busy processing a meal, having to also digest fruit adds to the strain, potentially leading to digestive system dysfunction and affecting the body's absorption and utilization of nutrients, thereby negatively impacting overall health. Exercising immediately. After a meal, the body adjusts to redirect a significant amount of blood to the gastrointestinal tract to promote food absorption, which is a natural physiological mechanism aimed at providing enough energy and nutrients for digestion. However, if one exercises immediately at this time, it disrupts this balance. Exercise requires more blood to be diverted to the muscle tissue for energy, which diverts blood away from the gastrointestinal tract, affecting the digestion rate. Consistently exercising right after eating can lead to a series of problems like indigestion, stomach pain, and bloating. The correct approach is to avoid strenuous exercise within half an hour after eating, and to wait 1 to 2 hours after meals to engage in more moderate activities like jogging or brisk walking, satisfying the need for physical activity without significantly interfering with digestion. After about 3 hours post-meal, the food should have mostly been digested, allowing for various forms of more intense exercise. Smoking immediately. Smoking after a meal poses significant health risks. The harm it causes is 10 times greater than usual smoking. This is due to increased blood circulation in the digestive system following a meal. When smoking at this time, harmful components like nicotine and tar from cigarettes are absorbed more quickly into the bloodstream and rapidly spread throughout the body. These harmful substances can severely damage the cardiovascular system, increasing the risk of heart disease and hypertension, and also affecting the liver and brain. The liver, being the body's detoxifying organ, bears a heavier burden from the harmful substances produced by smoking, impacting its normal detoxification function. As for the brain, these harmful substances may disrupt the normal functions of nerve cells, leading to memory decline and difficulties in concentration. Driving immediately. It is not advisable to drive immediately after eating because, as digestion progresses, a large amount of blood concentrates in the digestive tract, potentially leading to delayed blood supply to the brain. The brain is the body's control center and requires a sufficient blood supply to function normally. If blood circulation is not adequate, it can cause dizziness, reduced concentration, and slowed reaction times, greatly increasing the risk of traffic accidents. Thus, to ensure safe driving and optimal brain performance, it's best to wait at least 1 hour after a meal before hitting the road. Drinking tea immediately. Drinking tea after eating can interfere with the absorption of nutrients. Tea contains tannins, which can inhibit the absorption of certain minerals like iron, calcium, and zinc. If consumed right after meals, tea may bind with the minerals in food, reducing their availability for absorption. Therefore, it is advisable to avoid drinking tea within 30 minutes to an hour after a meal. This allows for better nutrient absorption and maximizes the health benefits of food. Taking a shower immediately. Showering after a meal can lead to various health risks. After eating, the body focuses on digestion, requiring more blood to be diverted to the gastrointestinal tract. If one takes a hot shower during this time, the heat can further widen blood vessels, causing blood to pool in the skin and reducing the supply to the digestive organs. This can hinder digestion and may even result in issues like abdominal discomfort or fainting. Therefore, it is best to avoid showering immediately after eating. It is recommended to wait at least 1 to 2 hours before taking a shower. Washing dishes immediately. Washing dishes after a meal may seem trivial, but doing so immediately after eating can lead to various health problems. The posture required for washing dishes, especially bending over, can exert pressure on the stomach, leading to digestive issues such as stomachache, bloating, or even gastroesophageal reflux. Therefore, it is better to wait for at least 30 minutes after eating before engaging in chores like washing dishes to allow the body to stabilize after a meal. Going to bed immediately. Lying down immediately after eating increases the risk of gastroesophageal reflux. This condition occurs when stomach acid backs up into the esophagus due to the horizontal position of the body. The acid can cause discomfort, heartburn, and potentially damage the lining of the esophagus. To prevent these issues, it is advisable to remain upright for at least 1 to 2 hours after a meal before lying down or going to bed. Engaging in heavy work, performing heavy labor or engaging in demanding tasks right after eating can burden the body significantly. This can lead to symptoms such as nausea, abdominal pain, and fatigue, as the body is simultaneously trying to digest food and handle strenuous activities. It is crucial to allow the body some time to digest food before returning to heavy work. Wasting time on electronic devices. Many people indulge in scrolling through their phones or playing video games right after eating, but this habit can lead to poor posture and increased stress on the body. Prolonged use of electronic devices can lead to neck pain, eye strain, and fatigue, which can impact digestion. It is best to take a break from electronic devices after meals, allowing the body to focus on digestion while engaging in gentle activities. These post-meal habits can negatively impact our health. Let's work together to maintain good eating habits and promote a healthier lifestyle.